How does laser iridotomy, relieving angle closure glaucoma? Have you ever wondered how laser treatments can help with certain types of glaucoma? One such treatment is laser iridotomy, which is particularly effective for angle closure glaucoma. This condition occurs when the drainage angle of the eye becomes blocked, leading to increased pressure inside the eye. So, how does laser iridotomy work to relieving this pressure? Laser iridotomy creates a small hole in the iris, the colored part of your eye. This hole allows aqueous humor, the fluid inside the eye, to flow more freely. Normally, this fluid moves from the posterior chamber, located behind the iris, to the anterior chamber, which is in front of the iris. In angle closure glaucoma, the iris can be pushed forward, blocking this pathway. The laser creates an alternative route for the fluid, bypassing the blockage caused by the iris pressing against the drainage angle. When the fluid can flow through this new opening, it helps to equalize the pressure on both sides of the iris. This reduction in pressure, known as intraocular pressure, is crucial because high pressure can damage the optic nerve and lead to vision loss. By allowing the fluid to escape, laser iridotomy effectively lowers the intraocular pressure, helping to prevent further complications associated with angle closure glaucoma. This condition often arises from a pupillary block mechanism. In this situation, the iris and lens come into contact at the pupillary margin, creating resistance to the flow of aqueous humor. As fluid builds up behind the iris, it pushes the iris forward, narrowing or closing the drainage angle where fluid normally exits the eye. The laser iridotomy procedure eliminates this blockage by making a small hole in the peripheral part of the iris, which is less likely to interfere with vision. Laser iridotomy is primarily recommended for patients with primary angle closure glaucoma or those at risk of developing it. It is particularly effective in treating or preventing acute angle closure attacks, which can be sudden and painful, leading to very high eye pressure. If left untreated, these attacks can cause permanent vision loss. The procedure is usually performed on an outpatient basis. Patients receive topical anesthesia and pupil-constricting drops to prepare for the laser application. A special contact lens is placed on the eye to help focus the laser beam accurately. The laser then creates a small, permanent hole in the iris. After the procedure, patients are monitored for any potential side effects, such as temporary inflammation or pressure spikes, but serious complications are rare. In summary, laser iridotomy works by removing the pupillary block that obstructs the drainage angle, restoring normal fluid flow, and lowering intraocular pressure. This treatment is well established and effective for managing angle closure glaucoma. If you have concerns about your eye health or glaucoma, it is always best to consult with a healthcare professional for personalized advice and treatment options.